I have decided to come live tonight just to talk about random things, random chit chats about the psychology around hair loss. I didn't feel ready to come live tonight. I've just had my hair washed and just kind of dried. I haven't finished styling it, but I wanted to come on live anyway, and so I am here. I know that nobody would be watching at this time because it's really quite late, but I wanted to come on live anyway. So it's just an opportunity for me to just be here quietly and just chatting to myself, I suppose. But if you happen to catch this and you are listening, you can let me know somebody has joined me. It's my sister. Hello. I didn't think that she was awake. I didn't think anybody was awake. It's good to join me. But yeah, my hair has just been washed. It's not really been dealt with. And so I said I'll come on live anyway, just to see what it's like to be here talking to myself. But tonight I want to talk about the psychology around hair loss and perhaps skin conditions also. I've addressed some things in the past lives. Today I want to kind of go in on it. It's just going to be a very slow chat really about what I tend to see within my clinic and what I have felt personally, and perhaps even some members of the family have gone through. And it's really quite important to just take a step back sometimes and just appreciate that things can get really quite difficult. Okay, so my name is Djanie-Hair. I am an advanced hair, scalp and skin therapist in Leicester, and I help people to look after their hair, scalp and skin. I help people to find alternatives when they're experiencing hair loss. I help people fix some hair loss conditions that they may be going through. I really enjoy working in the preventative manner. That's truly where my sweet spot is, trying to get people to the point where they can avoid hair loss rather than treat it. So it's really important for us to find a beautiful space where we are doing everything we can to avoid hair loss. One of the taglines that I put in a post once on Instagram was that if you are not avoiding hair loss, you will end up treating hair loss. And so really quite important to draw back on that and make that be part of the psychology around hair loss discussion tonight. So I help people in doing that, but I also help people in treating skin conditions that, start to become an issue for them. This could be because they have just started experiencing this, something has happened, pregnancy, they've perhaps just had a baby, and I had something on my tongue. And so I'm here to help with those things. Preventative measures are so much more effective than treatment methods. And this is me just as a gift to anyone that is listening, to understand that when you're preventing something, you find that the outcome, that the input that you're putting in preventing it gives you a higher outcome than it would do if you were treating the condition. So we must get to the point where we're always trying to prevent things rather than treat them. Okay, so if you're not preventing hair loss, you will end up treating hair loss. Now, that's not necessarily the same to do with skin. Now, skin issues that end up causing problems sometimes aren't things that we can prevent. I have an experience this weekend to draw on, an example on, because my daughter, my eldest daughter had issues with her skin where she has become quite allergic to certain things that we can't put our finger on. Now, this has been the case since she was growing up, and now it's still an issue now. And so in situations like that, we almost can't prevent the reaction, but what we can do is build resilience within the skin so that even through the immune system as a whole, that we can actually start to look after the skin properly. Gut health then becomes our biggest issue. So that is also something that we use as a preventative measure, looking after the gut health to ensure that we can build a system that is robust and able to withstand the pressures of things that we may be reactive to. Okay, so I am not a doctor. I'm not your doctor. I would always caveat my videos by saying that if you need to be diagnosed properly for any conditions you're going through, it is my advice that you seek someone who's a professional, medically trained, who can help you in doing so. If you need any of my treatments and services, you can find me on social media sites at Vegan Hair Salon UK or at Djanie-Hair on Instagram or Facebook, wherever. Okay, so the psychology around hair loss. Issues that we have found is that people tend to make judgments around why somebody's going through hair loss. If you're joining me, you can add any comments if you want to, but people tend to make judgments around hair loss, around people who are experiencing hair loss, without really knowing what it feels like to go through it. And so this is from the external in. I'm not really discussing how somebody's feeling, really. It's truly how people view people who are going through hair loss. And so we have this thing where people mention that health is wealth, or if you're beautiful, then you're healthy, and so on and so forth. And so if somebody's going through something that is perhaps no longer making them feel beautiful, or perhaps meeting the conventional standard of beauty, it starts to become a thing where they don't feel beautiful within themselves, but people who are looking out to them also start to judge them, okay, based on those grounds. And so that judgment is what adds the additional pressure onto that person who's experiencing hair loss. And it is rather unfair, because if you can sometimes imagine, if you're going through hair loss, you already know you're going through hair loss. You don't need the additional pressure or the additional judgment from someone else added to your situation. But people don't understand hair loss. The person going through hair loss does not understand hair loss, let alone someone else who isn't going through it. We used to think that hair loss was a thing that happened to men of a certain age, but we seem to be having more people that experience hair loss. I've had situations where a friend of ours or a friend of my daughter's at school at a very young age started to experience hair loss, and it was a long journey. And now at that time I wasn't really practicing in this way, and so I was not as helpful as I could have been. But to put it this way, the situation has been resolved, but the shame that that boy went through in going to school every morning, knowing that he was going through a condition called alopecia areata, which is a condition where the hair falls out in patches, in coin patches around the hair, around the scalp, and it can be in multiple places. Sometimes we have associated symptoms around the body, but he was going through this and it was just becoming worse and worse. And so he had to sport a hat, or a baseball cap rather, to school, and to have to explain that to children and the teachers that this is what he's going through, in the hope that they would understand. I also want to draw on a memory, or an experience rather, that I went through as a child in seeing another child at school go through alopecia in secondary school. Now that I know what that is, I understand that young girl at that time had actually experienced a hair loss condition called alopecia universalis. Okay, now this is where she lost all hair on her scalp, and it was gradual. This was a girl with very long hair down to her back. It was almost past her bottom, and it was just beautiful, fine, very shiny, dark hair that was just full of health. And suddenly she started losing the hair. So this video truly is just to highlight, in case you've seen someone who suddenly is experiencing hair loss, if you've just seen someone who you notice that they are perhaps wearing a baseball cap, or they're perhaps positioning themselves in a slightly different way than they ordinarily would, it is worth sparing a thought as to what could be going on. Okay, and some of these hair loss conditions actually affect other parts of the body. So you'll notice that the brows will go, the lashes will go also. And if it's in boys or men and they have grown beard, so they've gone through puberty, you'll notice that there'll be patches around the beard area. Okay, and so these are conditions that we have mentioned before, or I have mentioned before in my previous videos, when I say these are triggered by stressful situations. This is just the body attacking itself. Okay, it's inflammation that the body does not recognize, and so it starts to attack itself. No form of alopecia is easy, so it is important to refrain from saying negative things when you see someone going through hair loss. I know it's hard. And also where we have skin conditions, for example, like acne. And I know it's Acne Awareness Month this month. I've spoken about it at length. But I just wanted to draw up on that and say that, acne conditions, for example, people start to think that acne is due to, uncleanliness, of somebody just not being able to clean themselves well enough. And I've explained that that isn't the case at all. Acne isn't down to the fact that the person isn't clean or isn't hygienic. It is because of the buildup of the dead skin cells and the sebum together, forming this matter that, if it's not slothed away, can then start to become infected, sometimes even by our own system. So we have certain things that sit in the microbiome of our body and scalp, and they are parasites that eat away at these sebum and dead skin cells and things like that. And they then continue to live, they mate, they then combust, and then have babies. And they all live in our skin, scalp, and areas around our eyelashes and brows and so on and so forth. And so sometimes we can't prevent what is happening to us. We can be as clean as we can, but things can happen. I'm just trying to go with the compassion, the theme of compassion, getting people to understand that being compassionate can go a long way. There are things that can happen because you're not being as hygienic as you possibly can be. There are things that can happen, such as not washing your hair, for example, frequently enough, can cause some issues. As much as I've mentioned that these parasites can live on the skin and cause issues, they should be cleansed away. And so if you're not washing your hair, you're not cleansing your hair often enough, you then start to experience some of these issues, because some of the parasites that live in the microbiome of our bodies, as much as that these parasites are what we call commensalis, so they are not actually affecting you, they're not hurting your body, by their sheer existence, it can also start to cause issues, especially if you're feeding it. If you're feeding it certain things. So people who don't wash their scalps tend to try to find ways to combat the sensitivities and effects of not cleansing their scalps effectively enough. So when they start to experience sort of like itching, flakiness and things like that, they immediately go towards using products. What products can I use to help alleviate these skin and scalp conditions? Where in fact, dealing with the actual condition would be the best thing to do. In the scalp, we find that just a simple shampoo is sufficient in clearing away these parasites and getting rid of them. And in the skin, also the same, just washing and cleansing your face sometimes is good enough. If you're finding that you've got dead skin cells or your skin just feels a little bit drier, cleansing effectively is really good to start with. I've mentioned before that it is hard to get hair, scalp, and skin care right if you don't get cleansing right. So we can't forget that. Some of the feelings that people go through is the feeling of incompetence. They don't know what to do and they become unsure about themselves. And because of the fact that they don't know what to do, they do nothing. Sometimes it is just a simple case of there's just too much out there. And so because there's just way too much information, they don't know which one to choose, which one to use, which one could be great for them. And so they do nothing. Or they do all the wrong things. So my place in this space is to try and get simplified information out there so that people can actually grasp hold of what I'm saying and use it in a bite-sized way to help themselves at home, or perhaps seek out some help when they find that this is just not what they can deal with themselves. I'm just wanting people to know when to seek help, when to start doing some things for themselves, how to do some things for themselves, and when to go off and ask for some help. Okay, so I've mentioned hats and caps and things like that as ways of people trying to find their confidence back or disguise hair loss. I had a comment that was made to me recently when someone said, "Oh, I don't like women who wear wigs. I don't like it at all." So the person mentioned that because my guess is that they're talking about the women who, or the people who choose to wear wigs as an aesthetic style of preference. But they were not aware of the fact that there are people who also wear wigs because they don't have a choice. They are losing their hair. And so wearing the wig is the way to go. We also have those people who become hair loss patients because they're using wigs. There's also a space for that. But I'm talking about those people who unfortunately have become victims of hair loss and have had no choice but to wear wigs. And so when we're making these rather negative, inconsiderate comments, such as "I don't like people who wear wigs," I had to immediately correct the person and make them understand that it sometimes isn't an option. We don't get to pass judgment. We don't get to say these things about people if we do not know the true reason as to why they're doing it. If you know someone personally in your life who chooses to wear a wig, I have several reasons why, if they're not experiencing hair loss, why they should refrain from using wigs for extensive periods of time. I'm going to say that statement again. If you know someone in your life who wears a wig but isn't experiencing advanced hair loss, there are many, many reasons why they should stop using that wig. Okay, so people wear wigs and they enjoy it, but they don't put the measures in place to make sure that they are looking after their hair and scalp. People aren't taking the wigs off at night to allow their hair and scalp to breathe. People are not removing their weaves properly. They are not even having them installed properly. They're not seeking out the right kind of care for themselves so that they can help themselves when the wig and the weaves are removed. They're not looking after their hair prior to the wig and weave installations, for example. And so they're protecting their hair from something that isn't already good enough to be protected. They are protecting unhealthy hair. Okay? And they're making choices that aren't right for them. So there are some candidates or some patients who are more suitable for having weaves than having wigs. So I had a telephone call from a potential patient the other day who mentioned that she's experiencing alopecia because she has got a condition called lupus. But she chose to have certain weaves done for her, and she said that it encouraged her hair loss. And so she wants to now look at the potential of having a mesh hair extensions put in. So a semi-permanent hair extension put in via the mesh. During the conversation, she also mentioned that she would like to have, perhaps explore the opportunity of having a wig sewn onto her hair. And so I discussed with her the suitability of that, but the conversation had to be around consultation, heavy consultation. I'm going to put a live up. I'm going to come on live to discuss consultations in the week coming up before the end of this month. And the idea is to allow professionals to know how to do and conduct consultations properly, but also to help patients get the best out of their consultations, how to prepare before they go for their consultation so that they can get the best out of it. Okay? So wigs and weaves can help in the psychology around hair loss because it can help give you the confidence that you're going through, give you the confidence at the time that you need it the most, which is the time period where your hair loss is advancing. But really, we must be able to give ourselves the opportunity to access our scalp and hair so that we can treat it. Some treatments, for example, which will be really good for therapeutic reasons, such as just making you feel so much better about yourself, but also allowing you to bring circulation to the scalp area, are things like dry brushing, for example, when you're brushing your hair as it is in a dry state, but also massaging the scalp. That really can make you feel good. But it brings warmth, it brings blood circulation to the scalp, it helps bring nutrients along with it, encourages growth, but also encourages very good quality hair growth. Yeah? So I want to talk about, now we've spoken about wigs, I want to talk about makeup and things like that for the face. The skin of the face. So my advice to people has always been that if you want to wear makeup, then you must learn to take it off. If you choose to wear makeup and makeup is a thing for you and you want to wear it, there's nothing stopping you from wearing makeup. Makeup is great. It's so much fun. You can use it to change the way you look. It's so flirtatious. It's fun. It's just brilliant. You can put certain makeups on to match your outfit, match your mood, match the season, so on and so forth. So it's absolutely brilliant. But if you must wear makeup, then you should learn to take it off. You should learn how to take it off effectively, because otherwise that in itself could also cause problems for you, such as dryness of the skin, acne, and so on and so forth. But some of the videos that I've got coming up, I hope I'll get the chance to do them, but I kept my makeup on overnight just so that it can remind me of how it feels when you leave your makeup on overnight. So that I can, as much as I already know what happens, sometimes it is good for research purposes to put yourself in that position so that you can deliver the live effectively. So I was my own guinea pig, and I left the makeup on overnight. And honest to God, I don't know why anybody would want to do it voluntarily, by the way. I don't know why anybody would want to do it. My skin felt dry, it felt clogged up, it felt tight. I personally did not feel good when I woke up in the morning and I had the day's makeup on. So I normally use this term, which is learn to take the day off. Okay, so you've come home from the day at work, outside in public, just take the day off. And how do we do that? We do that by cleansing our skin properly, effectively, and we wind down. We make sure that we open the skin up so that we can feed it the nutrients that it needs, because overnight is the time where we are restoring the skin. Yeah, we are rejuvenating the skin. We are sleeping, and the process of sleeping actually gets those cells working. Okay, mitosis, which is the cell division, starts to really happen at night, right? And so this is a great time for us to start to look at, what can I put on my skin whilst I've got that downtime in sleeping that will benefit me when I wake up in the morning. It's a great time to use the sleeping time as the double prong attack. So you're resting, right? You're resting, you're restoring, restoration is occurring, but you're also using, so naturally this is happening, by the way, but then you're also using products topically to put onto your skin to give you that extra that your skin just needs from the outside in. Okay, and that brings me to my next point, which is the only way out of all of this, the only way out of effective skin, scalp, and hair health is the way in. The only way out is in. Okay, so we've got to try and look after ourselves from the inside out. Okay, so I saw a lady on social media the other day, and she was mentioning that alopecia does not stop the show. That is her tagline. She's experiencing alopecia, but she doesn't want it to stop her from having a great time. But every so often, she just feels so downtrodden by it all. She feels truly just sad about what she's going through. And if you're going through hair loss, you're going through skin conditions, you're going through some scalp ailments that really can be so bothersome, please know something fairly simple. Sometimes you can do just too much. You could just be doing way too much. Okay? Sometimes doing a lot less is all you need to do. It isn't seeking something else. The idea is not to go and find another product. I have got patients who come in, and sometimes all it takes is to strip back their regime, the systems that they've got in place. The only thing I need to do is to remove those things and simplify it for them. Okay, we have options for you. And if the current situation is what you're going through, is that we need to implement things in your system for you. So if the current situation you're going through means that we have to implement things into your regime, we have options. We have pharmaceutical graded products. We have naturally graded products for you. And it's all about what you want to do, which approach you want to go on. We can also use a combination of those, pharmaceutical and natural, to help to improve the cosmetic appearance of your hair, scalp, and skin. Well, really your hair and your skin, because we can't really see the scalp. Okay? And then sometimes we have patients who come in where they're expecting this stressful event that we discuss around hair loss. So I've discussed before, again, ad nauseum, about stress and how to manage stress, how to prevent stress, how to become resilient towards stress, some things that we need to do to try and help ourselves. Sometimes the stressful event is a happy event. And I have to discuss this with my patients because it's really hard to digest when I ask them questions such as, has there been a stressful event in your life recently? And they say no. They say no stressful event whatsoever. Everything's been great. In fact, I've had a great experience recently. I've just had a baby. And of course, that is a great thing. That is a happy event. But sometimes those happy events, oh, there's a fly in my room. Oh goodness. That is one big fly. Apologies if you're watching. Okay, I'll find a way to try and edit this somehow. Apologies, but we had the doors open because it was a glorious day today, and now I've got flies in here. So, oh gosh. Okay, I'll try and continue. And so, stressful events doesn't necessarily have to be a negative thing. It can be a positive thing. It can be a situation where you've had a happy experience. And so, oh, if I can't get rid of this, I'm going to have to stop this live and start again another time. So having babies can be stressful. It stresses your system because it causes trauma to you, okay? So if you are someone who's had a baby before, you'll remember that the advice for us is that we don't engage in stressful or strenuous activities at least 6 weeks, for 6 weeks. That is an opportunity to allow our bodies to get back to normal, to restore and repair itself, okay? Similarly to what we do at night when we go to bed, we are repairing and restoring our bodies. We need that time after birth for the trauma to settle. And so having babies, as much as it's a happy event, it can be a stressful event. Another stressful but happy event is planning a wedding, for example. Weddings are amazing. They are just so much fun. But the person who's planning the wedding may truly start to experience some traumatic feelings that will trigger stress in their body, and so could also trigger hair loss. Okay, so the psychology around hair loss is a very, very tricky thing to deal with for the person who's dealing with it, for the person who's looking at their loved one who's experiencing hair loss, but also to try and help people to manage it properly is also something that has to be taken care of with detail and with sympathy and compassion. Okay, so try your best to be compassionate. If you see someone who's perhaps behaving out of the ordinary, they're doing things slightly different to how they do things. So they're wearing scarves, they're doing things, wearing a wig more often than necessary or than usual, or they are, wearing a baseball cap and so on and so forth. I've explained that hair loss can occur in a child as young as 10, 12, pre-pubescent. It can happen to all of us. I have had a personal experience with hair loss. When I have children, I tend to lose my hair around my temple regions. And if I become too stressed, I also experience a condition called telogen effluvium. Telogen effluvium is just when your hair starts to shed. It falls more than usual, more than the 100 strands a day shedding. So this can happen to all of us, not just men, okay? And it can happen to women, and it can happen to all of us at any stage in our lives. So we really must get to grips with it. I mentioned about the fact that the only way out of this is the way in. So the only way out is in. We need to look at deficiencies that we're going through in terms of nutrients. Are we actually, you could be eating great food, but are you retaining the food? Are you absorbing the food, the nutrients from the food properly? Hair loss is a holistic thing. It's a holistic approach to health. We address the skin, we address the scalp, we address nutrients, we address stress management. We address so much. We address exercise, weight loss programs. Anybody who's engaging in a weight management program is somebody that we have to pay attention to when they are patients of ours, because hair loss can also start to present itself if the person has started a weight management program. Okay, so I say this to say that we just need to be mindful that there are so many stressful triggers within our lives that can start to cause hair loss and skin conditions that will start to affect us psychologically. So we just need to exercise a little bit of compassion for ourselves, but also for the people that we see who may be experiencing hair loss or skin disorders. All right. I am going to end today's live by saying that, should you have any concerns, if you have any issues with your skin, you need to be able to start writing things down. These videos are here to help you to articulate yourself. I use some of the science words, but I aim to explain them fully. And that truly is to help you so you can articulate yourself when you're going to have consultations with your GPs, with your dermatologists, with your estheticians. All those people are there to help you. But it's really difficult if you can't communicate what is happening, right? So my videos are here to help you be able to understand what is going on, know where you need help, and who to source for help. All right. So I'm going to leave you here today. A couple of people have joined me, which was just crazy because I wasn't expecting anyone to join me. I didn't even make an announcement on Instagram, but I've had 2 people join me, and thank you for joining me. If there are no questions at all, I'd like to say, of course, look after yourselves. All my love, good night and goodbye.